Well, good evening. I'm Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University, and this is the last Leading Voices in Public Health this academic year, and the last one for my academic tenure. And I can't think of anyone better to end this event with than our guest this evening. Leading Voices began in 2007. We've had over 100 speakers during that time, talking about some of the most important issues of our time. But our topic tonight is probably the most important topic that we've dealt with, and that is the impact of the environment on human health. Now, people always start the next sentence the same way, and then they lie. Our speaker tonight needs no introduction. But Senator Bill Frist is well known to all of us. But what people may have not thought about is he's probably the only person I know who has reached the highest level in 3 or possibly 4 different fields. Obviously, he was a transplant surgeon, extremely well known internationally. He became a senator, Senate Majority Leader, served 2 terms as he had promised to do. But really, it's after his term as senator that his work has been really exceptional. He has led a statewide effort to improve educational outcomes, which is really making a huge difference in our state. And now he is the global chair of the Nature Conservancy, really forcing people to pay attention to the impact that the environment is having on human health and well-being. And I can't think of a better way of ending this series than with Senator Bill Frist, a true leading voice of public health.
Hi, baby. Transplant surgery rarely begins in the operating room. It usually begins with a phone call. Typically, that call came around 7 or 8 in the evening from the organ procurement organization. A donor had been identified somewhere within roughly 1,000 miles of Nashville. Blood type, organ viability, time. I reviewed the transplant waiting list in my pocket and identified the patient whose life would be saved. My first call was always to my colleague, Dr. Walter Merrill. Every time I called, no matter what time, day or night, Walter gave the same answer: I'll be there. No hesitation, no questions. Then the team began to move. I would meet the organ procurement team at the airport, still in surgical scrubs. We would fly all night, not all night, but 2-3 hours during the night to the hospital, where surgeons from across the country had gathered, and usually at 2 o'clock in the morning, 3 o'clock in the morning, to remove the donor organs. And once we took out the donor lung, the clock started ticking. 4 hours, just 4 hours, that was all the time we had to get back to Nashville to prepare the recipient and complete the transplant before the organ lost viability. Walter would already be in the operating room preparing the patient. By the time I walked in carrying that donor organ in those coolers that you see, the chest would be open, the failing lung exposed and ready to be removed. The new one in the cooler I'm carrying, every step had to work precisely. It had to be like a symphony. Pam Everett was our 4th lung transplant. At the time, lung transplantation was still new, rarely performed, and by most still regarded as experimental. We could not promise Pam what life would look like afterward. In fact, at that point, no lung transplant had ever lived longer than 36 months. Pam understood that. If I get 4 or 5 years, she said, that's 4 or 5 years I wouldn't have had. Her recovery was really, really tough. Remember, nobody had done lung transplants until about 6 months before that time. Weeks on a ventilator, a couple of months in the hospital, and then slowly she improved. Pam lived. Dr. Wyckoff, thanks for inviting me. We've been friends for a long time. And I think I was last here 18, 19 years ago, not last year, but the last time doing something like this. And as all of you know, I travel the States, 6 million, 7 million, almost 8 million people. There's a lot of people to reach. And I was a doctor coming out of nowhere and ran for United States Senate. I lost my mind, I guess, my wife told me coming in. It's been a pleasure working with Randy Wyckoff. He has set a foundation here that is just unbelievably powerful, solid, and a lot of what I'll say over the next 30 minutes or so will be centered on how people build great foundations. And he's built a foundation in public health that is like no other in the country. We spent the afternoon out at the village and looking at what students are exposed to here. Nowhere else in America are they exposed to that sort of thing. So I know you're stepping down. Retirement, I got a feeling it's not going to mean very much to you, knowing you, your personality, and what you're going to do. I've asked him all day, now, what are you going to do? What are you going to do? And he said, I'm going to retire and do travel and, write and that sort of thing. I'm going to be calling you like every week for these sorts of things. So thank you for your service here. Pam lived, but for me, that story has never been about surgical skill, because the deeper story with what made that miracle operation possible in the first place. It was over 40 years ago, after training with Dr. Norman Shumway at Stanford, that I had seen heart transplantation. That's him on the left, and that's obviously me, much younger, on the right. And I'd left Boston to go train specifically with him because heart transplantation was a brand new field. Only about 15 transplants were being done a year. Heart transplants. We're going to be talking about lung mainly coming in. He didn't want to do lung transplants, but since I'd seen the heart transplants move from experimental to practical and sort of going at scale, I became fixated on the next frontier, lung transplantation. They've never been done in history, ever, successfully coming in. And as you can see, I was young at the time, but I had a dream and I had a plan to do that. The problem was that the obstacle was healing of the bronchial anastomosis that here, forget what it is, but that lung on the right is what I was transplanting, or the patient's left, but on the right there. And that bronchial attachment would fall apart in animal models, other models. Nobody could make that heal. Then came a remarkable breakthrough. Two Norwegian scientists discovered a fungus in the soil in Norway, a fungus that was later named Talipopladium inflatum. And from that was derived a drug called cyclosporin, a compound that amazingly suppressed immune rejection, but at the same time allowed that, up until that time, unhealing, it wasn't impossible, it allowed that bronchial anastomosis to heal. That single discovery changed everything. My dream that I was fixated on could come true. It opened up this whole new world of lung transplantation. It made possible, which had historically for decades and scores of years had been out of reach. Over the years, it helped make the life-saving lung transplantation available to thousands and to tens of thousands of people. But for me, it did something else. It changed the way I saw the world around me. It changed the way I saw nature. Nature, literally, a fungus in the dirt, made this miraculous procedure possible. Not nature as scenery, not as backdrop, but source, teacher, healer. Modern medicine has drawn from nature far more than most people realize. Cyclosporin was one powerful reminder of that truth, and it spoke to me dramatically. It was not just a breakthrough in surgical technique, but for me, it was truly awakening. And then over time, and I'll shift gears here a little bit, over time, I'm going to take you back to the operating. Another scene from my surgical days stuck with me. Another awakening. In the operating room you have to imagine it was quiet. I'm in my surgical gown. The patient is draped under these bright focusing lights. My whole world would narrow down to a surgical field, about half the size of this podium. It'd be about that big. The chest would be open, and there, deep in the chest cavity, is a diseased lung. One of 1,000 that I'd seen. So this is not unusual. It sounds dramatic. It is dramatic. It is important, but it's fairly routine. You open the chest, you see a diseased lung. Lungs darkened by smoking, scarred by infection, damaged by toxins, injured slowly over time by what the body had been forced to breathe into the lungs, to endure, and to absorb. Yes, a mottled lung, a scarred lung, tar on the surface, as you see there, a damaged lung. And as I stood there, again, the spotlight, the surgical gown, focused on this lung, I asked a question. What shaped this lung before I ever reached in to touch it? And that was the question that again widened my world, because what I was seeing in the operating room was no longer a surgical problem. It was not simply a matter of surgical technique, though technique obviously important. It was not simply a matter of rescue, although of course rescue matters immensely. It was not just disease. It was a new way of seeing, an awakening that the world outside the body had already been worked inside the body for years. I didn't come to this whole field of nature and conservation as an environmental activist. A lot of people come through that channel. I did not. I came to it as a surgeon looking into the body. And what I began to realize standing under those lights is that the world around us has far more to do with the health and well-being within us than most of us had ever imagined. Because the lung is not sealed off from the world around it. With every breath, the outside world comes inside. And the outside world enters us in many ways, more than breath alone. Also in the water that we drink, in the air that we breathe, in the soil under our feet, into the climate that's all around us. It's the environment we inhabit. The lung is where, for me, is sort of its most visible because outside is coming in through the lung, but it doesn't stop there. Once it gets into the body, it travels through the circulation. The outside world does not stay just inside the lung. Through the bloodstream and circulation of the body, those exposures and those stressors from the outside the world around us go where? To the heart, to the brain, to the immune system, to the kidneys, to the adrenal glands, to every organ that depends on the delicate integrity of the blood vessels that feed it. I'll shift gears a little bit because I mentioned I started the heart world, the heart transplant world, so heart surgeon and lung surgeon. I'm talking mainly about the lungs, but in the hearts I operated on, I also saw another version of the same truth. This fine particulate matter that you get from pollution or from cigarettes, but from pollution in the air, oxidative stress and inflammation damage that endothelium, which is the lining of the coronary arteries or of every artery in the body, that thin inner lining of the blood vessels that are feeding the heart that I do these bypass grafts on. And over time, that damage contributes to hardening of arteries, to heart attack, to stroke. So while I'm using lungs as sort of the imagery here today, because this is where I had this sort of revelation, this epiphany, this awakening, I'm really talking about something much larger. I'm talking about how all of the world around us shapes what's happening within us. And that's not just a metaphor. It's physiology. It's biology. Some of you don't know where you're sitting, or medical students who are here today, because we were just talking a few minutes ago, and they said, what are you going to be talking about? And I'm going to be talking about your future. No matter what organ you're going to be dealing with, or your psychiatry, or the mental issues, or depression, or anxiety, it starts out here. A few examples, starting with pollution. What we breathe comes down the windpipe or to the trachea, those bronchi that we talked about, into the lungs, and eventually into these little air sacs that are all around. And then that oxygen crosses into the bloodstream, and that's the miracle of the lung. That oxygen and some nutrients feed the rest of the body, but it's also the vulnerability. Because along with oxygen can come the fine particles, the smoke, the toxins, the other pollutants that are in the air. And they damage the lung, as we saw along the way. But some of these particles are so small that they cross those little air sacs into the bloodstream, and once they do, are carried by the circulation throughout the body. Throughout the body, inflammation arises. Throughout the body, oxidative stress rises. Throughout the body, endothelium is injured. And the destruction doesn't stop at the lungs. It reaches every organ and tissue and cell in the body. The outside world does not just surround us, it enters us. Pollution. The second I'll mention is food. The outside world reaches us not only through the airway, but through the reception out there, or through the cafeteria today where I shouldn't have, but I had a cheesesteak hoagie. But what we eat begins in the soil, and people don't think that much about it. But the village today, when we were over there today, and the consciousness that the students are taught here, that it really does begin in the soil itself, or in the water, or in farming practices, in what is grown, in how it is grown, and how much of it is later is processed or ultra processed before it reaches us. So then you begin to see that that food is not just fuel, it's information, it's exposure, it's biology, it affects physiology. So we use these words in the conservation world, regenerative agriculture, and most everybody here knows what it is, but it's kind of a strange term. But that's what it is. The food that we eat has this impact. The way we grow that food affects the soil, affects the water, affects the nutritional quality of what is coming out of that soil, and ultimately the health and well-being of every single individual in this room, and your kids, and your partners, and future generations. But it starts with the soil. It affects our health and well-being. But what's that mean? It affects how happy we are. It affects how productive we are in our lives, how well we relate to people around us, our loved ones and others, and how fulfilling life ultimately is. This world out of us coming inside of us, food affects that same inflammation. It affects metabolism. It shapes health and well-being. Third, I'll mention climate change. If you take the warmer and warmer days that we've had every decade for the last 100 years, especially in the last 50 years, you have what we call climate change, or the changing climate. If we talk about distant projections, and I'll talk a little bit more about language, of 1.5 degrees centigrade above where we are now occurring in 2030 or 2050 or 2075, it's good. As a scientist, I get it. You hit tipping points and all. But that's not really the message to the larger audience. It's not my message. My message is, because that's way off in the future. What can I do today to affect the future? A lot, but you just start losing people. My message is that all of this and the hotter days occurring decade after decade after decade after decade after decade, nobody can argue that, because it's clearly documented for the last 100 years, worse than the last 50 years coming in, affects our health and well-being today. We have more unstable weather patterns. We have more wildfire smoke. We have more strain on the body, but also the mind. Heat alone stresses the body. And then just heat. But then you start adding smoke, or you add poor air quality, or you add disrupted sleep, or anxiety, or uncertainty. The burden grows heavier still. There's physiology behind it. The hypothalamic pituitary axis responds. The stress hormone that we all know, cortisol, rises. The body works harder and harder and harder to maintain equilibrium. And mental health suffers too. Anxiety deepens. Depression worsens. Resilience erodes. And we have to remember that those burdens don't fall evenly. They fall hardest on the most vulnerable: children, older adults, people with chronic illness, the workers who work outside, those low-income communities, and those already living closest to heat and pollution and instability. And that's why when we talk about the changing climate or climate change, we call it and think of it as a stress multiplier. It magnifies pressures already bearing down on the body and the mind and human well-being today, not in 2050 or 2075 or 100 years from now, but today. But because the rate of global warming, that's why it matters, is already shaping our human health and well-being today. So once I began to see all this more clearly, I began to understand something else. And you'll hear me talking about climate change and the environment in a little bit different way, through the lens of a physician, through the lens of medical science, through the lens of a nurse, through the lens of a public health person. There was a time in this country when the language, the dominant language wasn't apocalyptic or cost or personal, but it was restoration, it was caring, it was healing, it was opportunity. It was not that long ago, because I'm older, and I was just in college, but in the 1970s, we passed the Clean Air Act, the Clean Water Act, the Endangered Species Act. And as they were taking shape, the care of the environment was not framed or shaped around partisanship or ideology or personal sacrifice. It's going, you got to stop doing what I'm going to do, or I can't work, or we can't be productive anymore. It was framed more simply about protecting people, about protecting community, about protecting the very systems, the nature around us, the kind of life that we can depend on. You know, there's a Tennessean Howard Baker, who all of you know or you've heard of. He was majority leader before me by probably 30 years or so. A good friend, a mentor to me, and he was instrumental in that earlier era of environmental policy development. He understood that stewardship of nature and the natural world and the welfare and well-being of people belong together. There was no separation there. But it was interesting from those days when this was like this was in the mid-1990s, but starting about this time, and I served in 1995 to 2007, 2 terms. I told all of you, if you vote for me, I'm going to serve 2 terms, and I stuck with it, and that was a good thing. Thank goodness I stuck with it, by the way. Be there today would be mighty tough coming in. But it was during those years that I can regard as hinge years. Instead of being about the welfare and protecting nature and protecting people and a better life, the language began to shift. And in those years, things began to be coded in a different way. It was these years were, I say hinge years because it didn't happen dramatically overnight, but it was over this period of time, about how environmental policy was talked about. The language did change from that protecting welfare. Welfare is the word that was used so much in the early 1970s, the human welfare, making lives better for people, to more about this burden of personal sacrifice. It's going to cost me. It's going to make it so I'm going to lose my job, or I'm not going to make as much money. It was built around burden. It was built around shame. It was built around guilt. It became built around political identity. Are you a Republican or are you a Democrat? The language stopped building common ground, pulling people together, keeping them at the table, and much more about drawing battle lines. And when that happens, people stop hearing the human stakes. They stop hearing personal health. They stop hearing well-being. They stop hearing caring, stewardship, responsibility. And that's one reason I believe this new and modern way of framing the environment and conservation and nature matters. And it is hugely powerful because it includes everybody in the room through that lens of public health. And so many of you are involved in public health, but through the lens of a Dr. Randy Wyckoff, of why it matters today, not just in the future. Because when you begin with the body, and yes, I start with the heart and the lung, but it's also the child that is struggling right now with asthma, with that older adult that's weakened by heat. If you start with that, the conversation changes. People come to the table. The conversation becomes less abstract, less partisan, much more human. And once you reframe it that way, more people do come to the table, talk in a civil way, maybe not agree, but talking in a civil way for a rational discussion. And to me, what's important out of that, having done it now for the last 5 years, I chair the Nature Conservancy globally now. So I'm before a lot of audiences on this. What's cool about it to me is that if you do that, all of a sudden solutions begin to emerge. And they may be out of unexpected places. But these solutions become, they don't just emerge, but you can view and talk about and discuss them much more clearly. I saw this 4 months ago. Tracy and I, Tracy is my wife, is usually with me all the time. She's on the board of the Tennessee Nature Conservancy, so we usually do these sorts of things together. But she and I went to a place called Palmyra Atoll. Now, Palmyra Atoll, you probably never heard about, but that's it. It's that red dot. And you say, where is it? It's about 1,000 miles south of Hawaii. And if you go over to the United States, it's probably 3,800 miles from the coast. And the atoll is probably, an atoll is like old, tops of mountains and the waters come up and volcanoes there. So it's lots of little islands that are around. And it may be 30 acres or so. And you say, why are we there? It's a Nature Conservancy reserve now. But here is what I saw. It's beautiful, but what stayed with me was not just its beauty. And we scuba dived, and the world is opened up before our eyes. But what it was that struck me there is that it is a living system, also apparent in playing out within a compact space about maybe 4 times longer than this room, what I'm about to say. You see this connectedness, this harmony, this symphony playing out of life. It's connectedness, the words, so kind of this mutual independence. The best word is harmony as I think about it coming in, but it's playing out before your eyes. Frigate birds roosting in the trees. You can kind of start up in the upper left, and you can kind of follow this. Those are frigate birds, and they're blue-footed boobies and birds that fly, terns that fly out. But they roost in these trees right on the coast. And this is how tight it is, just like 100 yards. They return their nutrients to the land below. Their guano enriches the soil. It nourishes the roots of the trees below. These land crabs that you see, these little red crabs, you can barely see them on the left, flourish. And they're sort of a signal entity, species for health. They used to be really small, but in a healthy, they grow coming in. And then all of this flows down, these nutrients flow down to that edge of the lagoon. And there the plankton are nourished, and the nearby coral reef there, you can see down below, just begins to blossom. And then the plankton feed those manta rays sort of in the middle to the right. They're kind of waving going by, and you watch them just eating this plankton when you're scuba diving, as we were. And then the smaller fish are eaten by these larger fish. And then over there are sharks. Yeah, you see some sharks, put them on there, because you're swimming with these, you're scuba diving with these sharks. You say, it's safe. And it is, because they are the top predator, but they're not threatened. And it's not the sharks, it's the tuna that chase the bait fish up, like we pretend like we're in the water, up to the ceiling. And then guess what happens when they hit the ceiling? Those blue-footed boobies and those terns and those frigate birds pick them up and take them where? Back over to the trees. And round it goes. A living cycle, condensed. You see it, you feel it. A healthy, balanced system in which each part strengthens the other. And that's the biodiversity at work. It's not decoration. It's not something that's nice to admire from a distance. It is harmony. It is resilience. It is the way that life holds together. And when biodiversity is lost, something far more than beauty is lost. The integrity of the whole system begins to fray. The outside world becomes less able to protect, less able to nourish, less able to respond to things like climate change, less able to restore, less able to sustain life over time. Dropping back just a little bit, at Palmyra for years, an invasive species had thrown that system out of kilter, out of balance. It broke the cycle that had evolved over hundreds and indeed thousands of years where this harmony had come together. But once that stressor, that species was removed, the ecosystem began to flourish. It began to restore itself. The cycle kicked in. The seabirds returned. Native trees flourished. These nutrient cycles began to flow, reconnecting. The coral system strengthened. Those fish populations rebounded, and the system began to move back to balance and to abundance. Balance and abundance. What different words to be using rather than punishment, burden, and guilt, partisanship. Yes, and we I talk about biodiversity a lot, chairing the Nature Conservancy, and I'm in some interesting areas, but Palmyra caught it. Biodiversity is this living architecture of resilience, of renewal, and life itself. And once you see that, and again, I have the privilege of saying that it all plays out in our own lives in different ways. But once you see that, nature becomes a whole lot less just sentimental. And I'm sentimental, so I love beautiful things, and I love nature. But all of a sudden, it becomes less sentimental and much more solution. Most people don't know what nature-based solutions are. Like everything else, you get these words, and when you're doing something like the Nature Conservancy, you talk them, and people kind of say, what's he talking about, nature-based solutions? But they know once they see it. If forests can absorb carbon, protect watersheds, and cool the land around them, that is a solution. If wetlands can buffer flooding, if they can cleanse water and provide a habitat, that is a solution. If reefs and mangroves can protect coastlines and can support fisheries and strengthen resilience, that is a solution. If those healthy soils can store carbon, hold water, support food production, and improve the nutritional value of food, that is a solution. If urban trees planted in cities, can cool neighborhoods and reduce stress and improve air quality and strengthen human health and well-being, that is a solution. And if oceans can absorb excessive heat and carbon while helping stabilize the climate around us, that too is a solution. So that is what we mean by nature-based solutions. If I sort of describe it, to me, that's it. But they are actions that protect and restore and sustainably manage nature and the natural systems around us in ways that improve health and well-being, that strengthen communities, that support the biodiversity that I just described, and help us respond more wisely to the pressures that already around us and are increasing around us. So these are not ornamental ideas. They're practical responses to real human problems. I shouldn't be drinking out of plastic, should I? This is pretty good, as I think about it, trying to think of good examples. I think nowhere is this kind of clearer to me, at least when I describe it, when we talk about what we can measure outside, inside the body, if it enters there, when we change the world around it. What's happening inside. So this is pretty cool. I remember in the early days, we began to first envision what is called the Green Heart Project in Louisville, Kentucky. And the question was simple, but really profound. If we change the outside environment as an independent variable, could we change what was happening inside the body? Nobody had ever really done that before. We know we feel good when we're outside in nature and under trees and all, but nobody had actually measured it. And this was a project supported by the National Institutes of Health, with the Nature Conservancy and many partners, built this remarkably simple experiment around a sort of a real clean, simple, direct idea. If you planted thousands of trees and shrubs in neighborhoods burdened by traffic or heat and environmental stress, would human health change in measurable ways? Not just mood, not just appearance, biology. And that's what made the project so compelling to me. because it was asking in a concrete and scientific way whether nature could function as medicine. So more than 8,000 trees and shrubs were planted, the outside environment changed. Researchers then measured what was happening inside the bodies of the people who were living there. And one of the markers, they looked at a whole bunch of markers, but one of those markers that they looked at was C-reactive protein. Those of you in medicine and health know that it's a marker of systemic inflammation that is linked to heart attack and to stroke and to cancer and other chronic illnesses. And what they found was striking. Inflammation was substantially lower. In other words, by changing the outside environment, they were beginning to change what was happening inside the body, measurably, definitively, clinically, and that's a profound idea. And it explains, or at least it helps explain, something many people already know instinctively, even if they've never used the scientific language for it. There is a reason people feel better in nature. There is a reason that when you go for a quiet walk among trees, your mind is calmed, your body is eased, and the world just feels more manageable. The body is responding. The stress pathways are being settled. The cortisol does fall. Nature is medicine. Not in a sentimental sense, but in a physiological sense. Trees are medicine. And once you see it clearly, then nature becomes less about scenery and much more about solution. And if that can happen in one neighborhood, if planting trees can measurably change human health and well-being, then the next question becomes obvious. What becomes possible when we begin to think at scale? I guess that's one reason that that I'm so optimistic today. It is the opportunity to think local and do things locally and then go to scale. And we used to not have the power or the tools to go to scale. Today we do have those tools. We've got financial tools. We have conservation tools. We have partnership models. Beginning today and tomorrow, we have artificial intelligence. These models did not exist in the same way even 10 years ago. When I first joined the Nature Conservancy, we had none of these tools for scale. And when I say innovation, or think innovation, because these are new things, so the innovation, most people's minds or audiences will go to technology. Increasingly, it means other types of innovation. Take finance. I took you to Palmyra, now let me take you to Belize. Tracy and I visited there last year with the board of the Nature Conservancy. We saw firsthand the beauty of Belize. You see the blue hole, you see the scale of the challenges at the same time. You see, for decades, Belize struggled under crushing sovereign debt. For the country, the debt of the country, like the United States, is beginning to suffer under our debt. Belize has been suffering under the debt for about 20 years. And it's a crushing debt. But they also are trying to protect one of the largest and most important coral reef systems in the world. This reef, the mangroves, the coastal ecosystems were central not only to biodiversity, but to the country's fisheries to feed its people and to export, to the tourism of the people who are coming to dive and see these unbelievable coral reefs. The resilience and the long-term well-being was being threatened, but the sovereign debt was in crisis. The nation was in financial distress, but so was its natural ecosystem. So the Nature Conservancy, again with the partners, helped do something extraordinarily innovative at scale. About 5 years ago, Belize completed a $370 million debt conversion for marine conservation. And it's a restructuring of the debt that we helped architect. And it was designed to reduce financial pressure on the country, but at the same time address conservation by helping the country commit to protecting 30% of the ocean that you see around there, 30% of that. This innovative transaction, without going into the details, again, unprecedented. It had been done in the Seychelles. We did it there first, and Belize was our second one. Reduced Belize's debt by a remarkable 12% of GDP. Think if we could do that in the United States. and at the same time created $180 million in long-term financing dedicated just to conservation. It's like new money, new resources coming to conservation at scale, going local to global. Think about that. A new, innovative financial tool reducing a country's sovereign debt, at the same time injecting new money into conservation, helping protect the Palmyra story of biodiversity, of strengthening resilience, preserving livelihoods, improving the economy, and supporting the well-being of a nation. It was a breakthrough idea. I'll shift out that as a first example. I'll give three, because it's not just beliefs. TNC, the Nature Conservancy, has a Nature's Bond program, and we now have done it not just in belief. I said to the Seychelles, but we've taken it in the last 3 years to Barbados, we take it to Nepal, we take it to the Bahamas, and we've taken it to the Ecuadorian Amazon. All of that will unlock over $1 billion, yes, new money for conservation, while improving protection and management across roughly 245 million hectares of ocean, hectares of calm, a couple of acres of land and of headwater, and protecting about 18,000 kilometers of rivers. All of a sudden taking global to global, going to scale with tools that we didn't have 10 years ago. That's why I'm optimistic. The third one I'll mention, because it's even taken it to even a greater scale, is another financial innovation called Project Finance for Permanence. Terrible words, PFP, Project Finance for Permanence. But it does solve this new construct, one of conservation's oldest problems. How to secure not just a payment or financial resources over 5 years or 8 years, but long-term long-term money upfront, guaranteed to spend on conservation. It hadn't been done before. What it does, it brings governments and indigenous peoples and local communities and philanthropy and capital under one durable framework. So then you can have financing, and you can have governance and accountability built into conservation and preservation of biodiversity and climate change all at once, all from day one. And then when that idea came, and even more ambitious one, Enduring Earth. Enduring Earth, this is the last one, is a partnership among 4 NGOs. So the Nature Conservancy, we're in 80 countries, every state, really big. But we need to partner with NGOs as well. So we partnered with the Future Trust, World Wildlife Fund, Zomalad, worked with 150 local organizations and leaders aiming to help protect and restore 600 million hectares of plants and waters. That partnership model matters because it allows us to go to even greater scale than any one institution could achieve. This is really big stuff. It is local to global. It's conservation at a planetary scale. And it's one of the main reasons that I'm optimistic. Innovation is not just technology, it's financial, it's institutional, it's collaborative, it's partnerships. So these nature-based solutions are not the answer, but they are a major part of the answer, but they're not wholly an answer. We also have to think seriously about how we're going to be powering the future, because energy demand is rising. We all know what is happening today with data centers, with artificial intelligence, with electrification, the extraordinary demands of the world that is more digital, more connected, more energy hungry than ever before. So the answer can't be about scarcity. The answer does have to be much more about abundance, about reliability, about cleaner energy. And that matters not only for the planet, planetary, but it matters for the individual, the human health, the human well-being, because cleaner energy isn't just a big environmental strategy, it is a public health strategy. There does mean less pollution in that area, be breathed, less particulate matter, saw get it up in those lungs, less information from marine heart solution that is diffused throughout the body, less strain on the heart and the brain, the way we think, the way we have cognitive learning among our kids. And here too, I'm optimistic. Wind is growing. Solar is growing even faster. Solar has been the fastest growing source of electricity in the world, faster than anything else for the last 2 decades. What's pretty cool, again pretty neat, is that the cost has fallen dramatically, and so dramatic in many places that solar is, in many places, the cheapest way in the world to produce new electricity. Roughly the last 3 years, from $100 has gone to about $8. Nothing else has fallen that fast. Geothermal is advancing, hydrogen and fusion. Geothermal, obviously today, hydrogen and fusion, yes, off in the distance, but it may be 10 years, it may be 20 years, it's not going to be 50 and 60 years. And nuclear, in my view, is especially important because it is steady. It's there 24 hours a day. It's there 7 days a week. It is clean. It has no air pollution when it's operating. And it's one of the strongest long-term answers we have. Here in Tennessee, as you all know, especially East Tennessee, including here, but not too far from here as well, we have real reason for optimism. Tennessee is not just sitting here watching the future arrive. We're helping build it. Nuclear is already the largest source of electricity produced in our state, somewhere between 42 and 50%, depending on what year or the last 10 years. TVA is leading the nation, moving small modular reactor technology from concept to reality. We have Oak Ridge National Laboratory, which remains one of the great engines of scientific technological innovation anywhere in the world. So technology is moving faster than many people realize. Nature-based solutions are advancing. Cleaner energy is advancing. And together they make one thing increasingly clear. Hard, yes, but solid. So where does all this leave us? For me, it takes me back to where I started, the operating room. Back to that quiet, looking into the chest, back to that surgical light, back to that diseased lung sitting in an open chest. Because today we understand more clearly what shapes diseases before I enter into the room, before the surgeon arrives. We know more clearly that what happens outside the body does not stay outside the body, and we know that we must protect the biodiversity that makes the living world resilient, that makes it harmonious, it makes it connect, that makes it balanced, it makes it capable of sustaining life over time. Repair matters, rescue matters, but upstream prevention matters even more. Simply put, we cannot treat our way out of the disease that we continue to create. For too long, much of the language around these issues, as I pointed out, it sounded like accusations of sacrifice, burden, shame. I don't think that is the right frame. I think the better frame is not fear. It is stewardship. It is care. It is responsibility. It is opportunity. The opportunity to protect the world around us, because it is already, you talked about this afternoon, shaping the lives within us. The opportunity to strengthen health and well-being now, not just decades from now. The opportunity to come together to build communities that are more safe, more fulfilling, and more humane. And the opportunity to act with optimism, because the solutions, as we talked about, are not imaginary. We have the tools today. They are here in nature-based solutions, in innovation, in cleaner energy, in the restoration, protection of biodiversity. I think back to those early days of transplantation. We didn't know all the facts at the time. We knew what the science told us that we couldn't do. But there was uncertainty. Some people, a lot of people, questioned whether it could really work. But we did have science with us. We did have public health with us. We had clinical medicine with us. We had courage with us. And we moved forward. 36 years later, Ham Henry is alive and well.
Pam there, this was about 3 weeks ago. Everett, remember the fourth transplant, one of very few earliest marrow cutter in the world, leading the world at the time. She is, this was, I guess, 2 Sundays ago, looking through his scrapbook, sitting on the table in front, but the book that she's holding, which I did not know about, is the Guinness Book of World Records. She, Pam Everett, is recognized in the Guinness Book of World Records as the longest living single lung transplant recipient in the world. It doesn't mean that every uncertainty disappears before we act. It means that science and courage and stewardship can carry us further than fear would have us believe. The world around us shapes the health and well-being within us. So let us be good stewards of it. Because in the end, protecting the world around us is one of the most important ways we have to protect the lives within it. Thank you, Rex. Stay easy tonight.
Senator, that was great. You have time for a few questions?
How many years have you been? 20. What year did you leave? It's not just, but you know,
No,
I'll be all every week. All right.
you've got my note.
Yeah, I got it.
Questions for Senator Frist?
Questions off, we don't have to be specific about place that.
Yeah.
Tony? Yes, sir. Tony.
I loved everything about the presentation. It made me worry a little bit because you had some stuff about black lung, kind of indicating that the problems that gap fossil fuel, burning fossil fuels. I worry about lithium and its impact on multiple populations. Appalachian been lower, but with coal mine, the Coachella Valley and very New Mexico, like with the but do you see that we're trading one problem for another, or can we work this out? Can we work this out?
Great question. It's funny, you should pick a better answer. When we first started pioneering the world of transplantation, and you got this, because you know the history that's there, and use lung transplantation, also in part transplantation. We did that before. We knew that we could take the human heart out and replace a heart that could be dying, actually down in 2 months. Like put a good heart into it. But doing that solved that problem, but it opened up a whole world of infections because the patients were immunosuppressed. There's a graft-associated atherosclerosis. We didn't predict. We had no idea what it was. So once we solved the transplant, the technical part, that's the easy part, kind of like plumbing coming in. It opened up a whole series of problems. And that's why schools of health science for public health or acute and chronic disease in medicine are so important to address that next problem coming in. All the patients that were done in the 1960s before I came on died of heart transplants in about 2 months because they got the technique. It was kind of a cool operation. It's fun. You got the patients that live for about 6, then they all died. 102 of them died because they died of rejection. So what Dr. Norman Shumway did, who I went to work with, he invented a little biotone put into the neck. You slip it into the neck, it's really easy. It sounds like you slip it to the neck. The reason the heart takes the heart out and you look at it, tiny little decent number of patient thought. Sounds like the done. You look at it in a microscope, and then you can treat it earlier. And then we could treat rejection, but when we're using too many steroids, we had to invent another immunosuppression because people died of it. So I guess I look at this sort of the unknown, not knowing the specifics, which you're the expert in fear, and say, I don't know. But I have so much confidence as long as you have places like ETSU and similar places around with exercise-based approach, we'll be able to figure these things out. My life is 20 years in medicine, and then I did go to policy world, again, medicine, people going to law school, or living law school students here a few minutes ago. And that's the world that takes things to scale coming in. But it, again, it sort of has to be its way all the way through. All right, what else? Anything? Yes, sir.
Sugar gets a fire.
Andrew, I think this is the appropriate place to make a public health announcement. January is Radon Awareness Month here. I don't know if it's national or just in Tennessee. Radon is a odorless gas that's found naturally in the environment. It's the second leading cause of lung cancer for non-smokers. If you go to the Tennessee Environmental website, they will send you a free testing kit. It's a very simple test, and then you mail it back and you get the results that this, if your house is in a certain level of EPA recommendation to whether you need correction or not. So that's one simple way you can perhaps prevent lung cancer.
I used to be sitting there a little bit. How many people have had their house tested in the last 5 years period? So they don't smell like that. So we're getting in there. So that's about, or when you sell a house here, you have to test it, right? But we can buy a house. Is that correct? Yeah, I think that's right. But we bought our house in Axbow, so in Franklin, the little partnership, Franklin. And you have a basement, and it's a historic home, you take in 46 or so. But it actually tested high radon. So, you know, not think about this stuff come down. And I said, well, it's high, but everything else shut down, so not worried about it. I got a basement down there, all this, you know, whatever you're supposed to do, more ventilation, that sort of thing. And I did test it about 18 months ago. I had no idea you were free, saw it. And sure enough, it had gone to the red zone. And then what do you do? First I thought, where to look, because my wife has some immune issues that are serious enough. And so, sure enough, she did it. We remediated the dents and have a little bit that goes in, run 3 parts of that, it was $18 today, and really cost a cost about $800. But then it's all current. So anybody that knows rate on a month or day or whatever it is, but it is something that's pretty worth the go. All right, what else?
It's also Earth Day today.
Is what?
It's Earth Day today.
Earth Day is today, and a little bit of the reason, could talk about a lot of things, but I want to talk about nature-based solutions stuff. It is Earth Day, thank you, Red for us.
Hi, thank you so much for your talk. It was really good. It really glad this is a little bit of my environmental spirit. So I recently did a project about West Memphis and the world's largest AI data center and how the great environmental impacts that it has on West Memphis.
Do you know anything about these environmental impacts, and do you think there's any kind of policy change that could help?
And the environmental impacts, what again? AI?
Yeah.
No, but you tell me.
Yeah.
No, you tell me what you advanced, and I'm serious about that, because how else in the venture capital world have started about probably about 25 big companies, about half of them are based around AI for all healthcare companies. And she telling me, she said today, in terms of the cost of energy cost, worrying about the sort of chemical cost as well, because in healthcare, once you get behavioral built and with AI, you are trusted, you have trusted voice, it can actually read you. Behavioral side, it can have downsides to it. Also great potential with the AI. And now you're getting ready to tell me about the environmental impact. What have you found so far?
So especially within the cave systems.
Talk a little bit about that.
Sorry, within the cave systems within West Memphis, it filtrates a lot of the water that goes within Tennessee. And Elon Musk put the world's largest AI data center right next to that filtration system to have access, I think, to get to this water. This is pulling so much water that it's ruining the filtration system because of the vacuum is at an imbalance, and it's pulling in coal and like residue from the whole construction sites within the 1960s or 70s, and it's ruining the filtration systems, cave systems within host office.
Do you ever hear that? And what you just heard, you say, scary, but also so factual. Round of applause. Unbelievable. Thank you. It registers to me, and I'd read about it, but I haven't ever heard you explain so clearly like you just did, right?
Thank you.
This is the price you pay for finishing early.
Yeah, I know, that.
Hi, Senator. My name is Janine Young. I write for the CNBTC student newspaper. I cover community public health, and recently I wrote an article about EWS Technologies, uranium processing facility that they're building in Jonesboro, and the controversy surrounding the redistricting there. And I was wondering what your thoughts on redistricting the farmland for uranium manufacturing was, and the environmental impacts.
First, simply, are you ready? You have to tell me what that is.
So-
what did your article say? And please stand up. You need to kind of look at me over here so they can see your face. And somebody should stand up.
So
What did you say? An article's written for what?
the East Tennessee
You
ETS
don't sit-
newspaper.
Thank you.
So in my research, EWS Technologies is building a facility to produce refined uranium for defense contract purposes. They're planning to build a facility regardless if they got the approved by Washington County Commissioners. It was denied back in January this year. It was pre-approved early mid last month. There was a lot of controversy with Jonesboro residents surrounding the redistricting due to it being very close to Gate Prairie High School, a local elementary school, and other farmland. And a lot of people think due to the semi-recent impacts of natural disasters like Hurricane B, there is that threat of if something similar were to happen again in the future, this could negatively impact the land and the people around it. So do you think it's smart for companies to go in the best interest of them, like national interests, in places like defense not happen? Or should they listen to people?
Yeah. How did you've answered, the question I give it in yours, and excellent explanation. Everybody hear that coming in? And the policy role is an integral, and it applies just using that as an example of the environmental role. And part of this change in the 1970s, where it was about health, well-being, welfare, in this hinge area of 1995 to 2005, when I was in Washington, where it moved much more to progress, uranium, energy, national protection, cost you need to sacrifice for it. It really comes down to that. And that's what policy is all about. It is taking this way, the universe where you are, starting locally. That's why our democratic process is so important, where you do it at federal level. You have local people, congressmen, and then the Senate comes up. But to take that balancing act in again, the one thing that you clearly have done in your analysis, that I, being the only position in the United States Senate right there, there's no doctor there. There hadn't been a doctor or a clinical scientist there since 1928 when I went to the Senate. Now they're like 20 in the House and there are 4 in the Senate, so it's changed. They've been nominated. And the one thing that I go on, just like the reporting, is the science. Ask the question. It's the exact same question you have asked. And for not asking that question of what the scientific costs are and benefits, and they're not on the table, we cannot ever make policy effective. And that's why we need smart people, only by democracy in the Senate. That's what you need in a government. It has that science, that factual verification. Congratulations, you great people. Once again, applause. Hungry. Thanks. Well, well, I don't know, question about came from a little short one too. Take out your iPhone and just see what happens when you do that, or not your iPhone, whatever you have, and just see what happens. The man's dead. Aaron, we try that and see. It don't pops up because I don't know nothing's dead.
Service.
A link tree. And then what's on the link tree? Oh, there is an email there. That I promise you, brother, if you do give me your email, you will give it to me maybe once a week. You always delete it. But I do use social media. And on Linktree, you'll see those sort of articles that I write, and they are hopefully common sense. They're built on science. They're built on this sort of communication, being open, listening to really smart people coming together, in the aggregate collectively. So the only way we can sort of change the language and make progress with things in balance in a common sense way is to keep people in the room and keep them talking. And climate change is a great example. Bang, people go to the extreme. And so what I spent the last 10 years of my life doing, both writing and speaking, you're trying to pull people together. And it's hard and it's frustrating. But if you look in there, you'll see there's a little thing to do a myth diagnosis once a week. And in 55 seconds, I will take what I hear as a myth, try to debunk it a little bit, and as much as you can do it, 50 seconds, and then give a little prescription coming in. So anyway, that makes us think, now, I don't have to say the verse in there all the time, once you put it, but you are. Does it say on your phone? Well, if it doesn't say on your phone, go ahead and put your email in. I say that because social media is, to me, really sort of important in the news. All right, what else? You want? Yes, sir.
Thank you, Senator Presser. Great talk. You did an excellent job of bringing climate change and environment down to personal level and how they impacts each one of us individual. What can we do as audiences, unity, to help amplify your voice in the face of a cry debate on the media that says climate change isn't real? It isn't impacting us. How can we amplify your personal message to make an impact?
Yeah, no, it's a great question. That's the heart, what I decided to spend this time on. So what I've done, it's one of the things that mean something to me, that I know has the impact is nature. So that's why I first joined a local group that thinks, they don't have to think like me, but they have to have a lens that's wide enough to accept people like me and people to the left and people to the right. And there are a bunch of ones out there. You have to look locally. And then I looked locally with the Nature Conservancy because it has this sort of reach. And the Nature Conservancy in Tennessee is conserved over 600,000 acres. We have been hugely involved with all of the state parks and national parks here. And we do people, indigenous people, we do streams, we do trees, we do climate change. And so that's kind of a place to start. And you go to the website, pay $15, and you don't have to pay $8. You become a member and you just hit the newsletter. And then it gives you a template that's in the middle that puts the science out, is extremely sort of nonpartisan. Obviously, it got categorized, but that's probably the most effective way. And then you say what your passions are. We saw it today, touring today, to see the discussion of the students here around soil and using natural materials to sort of open up all over the world with them coming in. That's probably the number one thing I would do.
One more question, sir.
Yes, sir.
Thank you for sharing all that you did today, Senator. I do have a question. So I am the Chief Financial Officer for a national nonprofit, and we do focus on conservation,
And what was the name of that?
coalitions, and collaboratives,
Is that
also known as COGO, coalitions and collaboratives. And one of the things that we have helped communities with is acquiring federal funds. We serve as a pass-through entity, bringing federal funds directly to communities. And the last couple of years, we've brought in just over $64 million from the Community Wildlife Kickstart. My main concern, and the question I do want to pose to you, is I'm concerned about the next generation of conservationists. And your forest development is a challenge in conservation, and specifically when it comes to acquiring funding for workforce development and conservation. Are you aware of any specific initiatives through the Nature Conservancy that is working toward a workforce development strategy for the next generation?
I think federal funding and state funding and local funding.
Sort of one bucket you had. The other but workforce development, which we talked about, and absolutely critical.
Absolutely critical. And what you're doing, the sort of community understanding, wildfire, but also understanding sort of practices, sustainable forestry, which you come out of what prescribed wording actually does to improve the health of the soil coming in. And the workforce development, who's going to be teaching all that? Who's going to be doing it? And again, what I saw today is like perfect example of a institution take people into the field like no other place I've ever seen and give them the real experience. Even if it's not exactly what they saw, the creative process that you have to go through can apply broadly, whether it's conservation or preservation or climate change. So that sort of training. The funding itself, I can't respond to directly, but the reason I spent so much time on nature bonds and blue bonds and sovereign debt at the same time, conservation, linking these together at scale and enduring, and the project finance for permanence, those other things that you wouldn't normally think about. That's billions of dollars that are coming to conservation that you probably hadn't thought about very much. That is in the last 5 years. That's the sort of creative thinking, because you're going to have administrations like the current administration today who cut science funding, who distrust science, who doesn't believe in that the world's getting warmer, and because it's science overall. And those kind of trends will come and go, but I always say we have to go back to science. Think creatively, innovatively, not just in the technology pulling carbon in the air, which I love, and not just in looking at new types of fission and fusion and hydrogen, but also these finance mechanisms, which do bring billions of dollars from the world. Events not coming out of air. It's not coming just from the federal government or just from the grant-based organization. I will close this because the development keyword here is it's not just in the United States, but philanthropy itself is going to continue to explode. The nature of giving and development, you've got two development officers that I met tonight, we talked about it briefly, is really exciting because government, not just in the United States, is going to be funding sort of science less across the world. And that's going to probably stay now. And there were awful people in a world that is getting vastly richer. Now, sadly, it's getting richer by 10 people and not millions of people. But that money today will increase over time from a philanthropy standpoint, which means there's going to be much more money coming in, I think, over the next 10 years, in spite of government funding, probably not so much state, Governor Lee, and they are really good conservation coming in. But around the world, and what's happening in the United States is happening today. But the good news, I see a lot of having foundations and big philanthropists, that is going to markedly increase over time. So it's going to have to change the way we sort of approach. Dynamic offices are changing greatly. It's going to take that kind of creative thinking. If we think we're just going to get more money out of the state and the federal government, it's not going to happen. But I'm optimistic about that because I talk a lot to the wealthiest people around. The heck of the in the way money come in, it's terrible. But at that job, that would be so big. And I mean, you're kind of in that business, and these young girls got to kind of rethink about how we live around this. Listen, it is really great. Today at School of Public Health here, it was really gratifying for me to be able to walk around as Randy and just see whether it's the mission that's on the wall of the greater mission for health, healing, World Health Mission, or going back to his office and seeing not the relics, little examples over his lifetime, his professional career here. And I said to him, each one of these I know is a book of writing behind it coming in. And then to go outside and see all the alumni from the School of Public Health here over not just the last 10 years, 20, 30 years, but since its inception is really, really smart and really, really special. And then the last thing is I did see one category, Hope Through Healing Hands. Hope Through Healing Hands, Aaron Rogus that runs it with me. And it was set up at the year 2000. And I was so proud to see, I guess, probably 30 beneficiaries of Hope Through Healing Hands, which is the entity that Karen and I run, who have been able to go around the world with the knowledge and the base of knowledge and information that you make possible through ETSU. And they go away, they come back, and they apply it. To see that list printed there gave me a great deal of satisfaction. Not from me, and I'm from Hope Through Healing Hands, but because you've had a leader here for almost the last 20 years who's made a priority. Fear, the region, the state, the country, the world. Brandon Waterkoff, one last round of applause, not to me, but to anybody.
Then how about a round for the Senate? Something separate, because we knew you flew in. We always like to give large, bulky gifts. This is just a memento of your time with us. But like, if any of you all went overseas with support from Hope Through Healing Hands, I know there's at least two of you. Would you raise your hands? Yeah, so there's some bucks here who benefited directly from you. And I will say, both of them are now in our faculty here. So they are the best.
All right, I good. Thank you all. Appreciate it.